Today we welcome Dr. Richard Medlicott, who is the former Medical Director of the Royal New Zealand College of General Practitioners, and also he has his own practice in Island Bay and Wellington. Richard has an interest in health IT, health governance, and extreme sports. And I was wondering, Richard, is that an interest as a doctor in trauma, or is it actually as a participant?
Well, I'm a little bit extreme. The mountain biking mainly. Funnily enough, I think I've turned down the racing days and just volunteered to be a medic on an upcoming multi-day enduro event. So perhaps both.
I got a bad concussion doing mountain biking once,
Yeah.
but I'd prefer not to talk about it. Yeah, today we're here to talk about patient portals, and I know you have done a lot of work around that. How long has your practice been using Manage My Health's patient portal?
Pretty much from day one, which I think is about 2012. So, 13 years, something like that. I think we were the second, or I was the second GP to use it back in the day.
You're obviously, in that regard, a believer in technology and its role in healthcare.
Yeah, absolutely. I think I got it from my father. I've got the geek gene from him, and he was a GP as well, so really interested in health IT. It's just a tool that we couldn't do our jobs without. Trying to go back to paper would be impossible in today's environment.
What first prompted you to adopt this patient portal, and why did you choose Manage My Health at the time?
So back then, MedTech, which is our PMS, and Manage My Health were bundled, and I had a pre-existing relationship with MedTech, being on their advisory group. And Sanjeeva Samawira told me about it. He was the chief operating officer, and it looked really interesting. I was aware that there was a little bit of use of portals overseas, like in places like Kaiser Permanente and so on. Well, okay, let's give this a go. And just being an early adopter, I leapt down that line and haven't looked back.
This question really is for people who don't know, but what does a patient portal do or allow you and your patients to do?
At a broad level, it gives the patient access to first up their record, and then depending on how you configure it, online access to you and the healthcare team. And that's, it'll probably come up in the conversation later on. But, they can book online their appointments, they can see their results, they can order repeat prescriptions, and then they can also message you. And if you want to go down that line of email, essentially email consultations and advice.
And what's been the adoption of the patient portal by your own patients? How has it changed your daily interaction, if at all, and how enthusiastic have patients been about it?
So our practice has got about 70% of our enrolled population on the portal. We're a pretty large practice. We're 14,000 patients. Um, I think I've probably got the highest percentage in the practice, so it varies a little bit. Um, and having those numbers up high is where you get to the benefits. If you're going to switch on a portal, you want lots of people using using the online appointments or the repeat prescriptions, because it cuts down the work that you have to do anyway, but it cuts down the work for reception at that end. Um, on the whole, patients, I think, are very in favor of it. We have our messaging switched on so they can contact us, and we sometimes it feels a bit of a burden answering those messages, but you have to take the big picture and think, okay, we've got a high capitated population for the number of GP appointment slots that we're offering. And we manage that high capitated population by doing messaging. And we set aside some time to do that. And if you can manage something in 2 minutes and charge them an e-consult for whatever you decide it's worth, um, then you've got their capitation money. You've dealt with something in 2 minutes rather than taking up a 15-minute slot. So it's useful for the patient. They get convenience, and it's useful for us. It actually doesn't feel like it at the time, but it's probably saving us time.
Can they actually do a consultation with you via messaging?
You can, and we have some service codes called e-consults, but it's generally not advised. I mean, what you don't want to get into is a whole back and forth, the whole of the messages going back and forth about this condition. If that's looking like it's going down the line, or you get, War and Peace for the first message that comes in with a whole lot of detail, it's kind of like an immediate, this is a consult, either book in to see me in person, or we'll do a telephone or video consultation. The videos we do over the portal as well. So trying to nip that in the bud, I think it can be a little bit non-productive once you're starting to get into a long back and forth. However, if the patients are aware that, if they have sent a long complex thing in, and I'm aware that they might live out of town or really want to do this via email, I will write back saying, hey, look, I'm going to book this into a slot and I'll charge you a full consult fee and I'll come back with a detailed response. So you as the provider of the service have to take control of what you want to offer and put some boundaries around its use. Otherwise, you'll get inundated. If you keep on replying to people, their queries, and you don't charge them, and you do big, long replies, then of course they're going to think that's great and going to keep on hammering you. So make sure you set your boundaries, is what I'd say.
And have you seen a improvement in productivity for the practice overall?
I think it's a really hard thing to measure in terms of how much that's driven by the portal versus being a well-run practice with a good manager, being in the luck of being in a increasingly affluent urban practice where we've been able to get our staff. So, there's all kinds of confounding factors around efficiency, but you can do some really basic stuff, like every appointment booked online is about 2 minutes of receptionist time saved, and we're getting over 50, well, probably about 50% of our appointments are booked through the portal. Similarly, every repeat prescription that's done through the portal is saving time at reception end or nursing end, depending how you take your phone script orders. So those things are really easy to measure and know, and clearly saving us lots of time and money. So that's particularly at the admin reception end. In terms of the GP end, I think that's harder to measure. As I was saying before, we look at the list of requests coming in, and I know a lot of practices have switched off that messaging ability. And sometimes you go, oh, but you've got to keep that big picture. It's letting you, I think it is letting us be more efficient and have a high capitated number per doctor. That's the big picture you've got to hold on to. But as mentioned earlier, you've got to put boundaries around that, otherwise you may get inundated.
Which is important when you consider the shrinking ratio of GPs to the actual patient population. Have you noticed one demographic perhaps over another that has adopted the technology more than the other?
Yeah. On the whole, it is younger, not the kids and adolescents, although we do open it up to them, mainly because they don't actually have to come in for much. Usually it's more the 25 to 60 age group, but it's not marked. I mean, I have patients in their 90s who use the portal. So the idea that because you're older means you're not tech savvy is just not true. There's a tendency, but it's not strong.
Were there any challenges in getting staff on board with this and patients, and how did you manage the change?
Gosh, it's going back a long time. It's just built into our DNA at the practice now. So I guess with anything, you need to have some agreements that you're going to use it. I'd strongly recommend you set up those boundaries in terms of terms and conditions that patients see when they're interacting with the portal. So you've got this base, and then it's training. I mean, I always think, oh man, everyone just needs to jump online and do the stuff, and they'll see how it works. But I'm a geek, so I like testing software, and I recognise that that's not actually the most common experience. So a little bit of training, a little bit of reassurance. Sometimes things can get a little bit technical. So having someone in the practice who's kind of a champion is really important, who people can go to for advice, or issues that may arise. It looks like it's any change management process, right? It's not going to happen just because one person does it. Not everyone will follow.
I mean, one of the biggest issues with adopting new technology that's supposed to improve efficiency and productivity and outcomes is the learning aspect of that technology. It can sometimes be daunting, and so there's a lot of drop off or abandoning of the technologies just because of the learning curve that has to go into it. What's been your experience around the Manage My Health portal in that regard?
I think for the provider end, it's not too bad. I mean, general practice is a complicated business, and so we actually have to keep track of lots of things through our software, through our PMS. And so we're used to that software being developed. So we're used to having to press buttons and find stuff and do things. And a portal, because Manage My Health is integrated into our PMS, everything comes into one place. Everything comes into our provider inbox with a Manage My Health tab on it. So that's where you go to. I think one place to rule it all is really important. And similarly, you've got an icon that's always sitting up in your toolbar to send a message to a patient. So they've kept it pretty simple on the whole. I think at the patient end, it can be, because they're not immersed in health software all day, every day. So for them, there's a bit more of a learning, and I guess it's up to the Manage My Health people to make sure the app and the web is user-friendly, and I think they do a reasonable job of that. I think there's always room for improvement. Software's never finished, right? But I think from the provider end, it's relatively simple.
What are the features that your patients use the most often, and why do those things matter?
I mean, internationally for years, and no difference here, the main things people want to use their portal for is booking appointments, ordering repeat prescriptions, seeing their results, and contacting their healthcare provider. That's the big four. Now, there are other things built into the platform, so I do a reasonable number of video consults through it. They can track health measurements such as weight and blood pressure and glucose, and that can upload into my PMS, into MedTech. I suspect most GPs don't have that switched on, but I quite like that for remote monitoring of patients. There's a journal in there which they can keep private or share with their provider in terms of how they're feeling and some observations on their health. There's a calendar. There's access to information on all kinds of health topics such as diabetes or heart disease or depression or whatever. So it's quite a rich platform that the patients can explore, but primarily it's going back to booking appointments, seeing the results, getting a repeat script and contacting their doctor or nurse.
Do you think your practice could do without the Manage My Health portal? Yes or no? And
No.
what? No.
Yeah.
Why not? Yeah.
Oh,
Why not?
because talking about those efficiencies, all of a sudden we'd have a whole lot of people who would be wanting to make an appointment to see us to talk about something which takes a 15-minute slot, and I have to set that aside, and all of a sudden waiting times would go from 1 or 2 days or seeing on the same day out to a few weeks. I just think we operate a real tight margin of appointment availability, and once you start to flood that, it can very quickly snowball. So that's just the doctor's appointments. Then you've got how do you let patients know what their results are? For us, the default is it's on the portal. We'll get in touch with you if there's something significantly abnormal. So we write a comment, they can see it. We're not sending them, hey, your results are here, have a look at that. Ordering repeat scripts, probably 75% of my repeat prescriptions come through the Manage My Health, come straight to me, do it. If that had to go through reception, then we're suddenly having to hire 2 more receptionists between having to do repeat scripts and taking appointments. It might be 3 receptionists, so it's just efficiencies around running the practice. And yeah, it would be a nightmare to go back.
And of course, with repeat scripts, the patient pays, on the spot basically for that script. So there's none of the admin or invoices or anything like that.
I mean, that again is an option. You can, and that's what I like about the granularity of how you set up your system. So you can switch it on such that you must pay beforehand, including you can set up to pay for appointments beforehand, repeat prescripts, or you can have a hybrid model where you can pay online or pay later. Now, we're, as I mentioned before, in a suburb that's pretty well off, and so our bad debt rate is very low, and so we haven't switched on the compulsory stuff. What we are thinking is actually having a discount for repeat scripts where people do book it online and pay online, because that just takes the receptionist out of the loop entirely. And people can be really sensitive to, $1 difference can change behaviour. We haven't done that yet, but we're certainly thinking of it.
Putting your geek hat on for a moment and looking ahead, what role do you think digital tools like the Manage My Health portal will play in the future of primary health care?
Okay, well, a basic one would be, and this is something I've talked to Manage My Health, I'd like to see more integration with other platforms such as Google Health Connect or Apple Health, or so that your Manage My Health can talk to other platforms, be it Garmin or Strava or Map My Ride or a number of other fitness tracking type things out there. So that's one thing. But of course, everyone's been talking about AI, and it's going to be fascinating. So these records that the patient holds are incredibly rich for health data. And the question is, what can you do that? If you've got diabetes and heart failure and some impaired kidney function, if you plug an AI into your Manage My Health or whichever platform you're using and say, please give me some insights into my diabetes management. And yeah, that could be really, really powerful. It will be really powerful. And that's, it's not happening yet, and I don't know if there are concrete plans to do so, but that's going to be fascinating. And then the question is, what does that do for GP and nurses' workload? So a lot of what we do is algorithm-based, right? And a lot of that can be standardized by software. So look, I recently bought myself a smartwatch. Find it incredibly motivating to tell me to do stuff. And not everyone, obeys the machine like I do, but you build this interaction between your health record and AI and something and a wearable, and you can really start to nudge behaviors. I think that's going to be fascinating. And one of the things that we pride ourselves on as GPs and nurse practitioners and practice nurses is our ability to deal with the complicated. And we say, oh, well, computers can't deal with the complicated. It's too arcane and there's too much magic in there. I mean, I've plugged some pretty complex scenarios into AIs, and it comes up with nuanced answers around recognizing the risks of bumping up that pill might make the blood pressure low and the renal function. You don't have to monitor that. So, yeah, that's really exciting, fascinating.
It's a good prompt to help you raise questions about what you're doing, almost as a thinking, something to help along your thinking.
Yeah, for sure. And, the patient portal is not front and center during our consultations. That's our PMS that does that. But, you can imagine it starting to be a little assistant, not taking over, but an assistant. I did a video consultation with the patient yesterday, and I'd recently been looking at a drug called candesartan, usually used for blood pressure and heart failure. And I was a bit unaware because I'm a bit old and maybe not keeping up with that like I should have, that it could be effective for migraine prevention. And another patient had told me about this. So I jumped on Copilot and just had a big long conversation around which are the best drugs for migraine prevention, asking it things like numbers needed to treat, side effect profiles, dropout rates, and so on. And just had it was like having a conversation with a migraine expert. I checked the references that came up with; they were all kosher and there. And then so that had come from a conversation a few weeks ago. And then yesterday I was having a conversation about a patient on a video around migraine prevention. And so I had that chat with Copilot stored. And while we're doing the video over Manage My Health, I sent her a link to that chat over the messaging on Manage My Health, which she could look at and she could read through and go, oh, that's really interesting. Okay, yeah. No, I'd like to go with sartan rather than nortriptyline, which is what previously my go-to drug would have been. But it's actually similar efficacy of the drugs, but a lower out rate and lower side effect rate for candesartan. So that use of AI brought to my attention by a patient and interacting with the portal has kind of changed my behavior and done my that's continuous medical education. I'm going to write that up for my college GP training points.
And I think, as you say, it's important that you ask the AI to give you the references.
Yeah.
Information comes in to double check it. I'm curious though, has Manage My Health portal enabled you to see more patients, to take more patients onto your role?
I think so. Talking about before around, so I do 6 sessions a week, well, 5 sessions, but they're slightly longer sessions than most. So that makes me seeing patients for about 60% of my working week. And there's a lot of paperwork, we all know that. Outside of that, my registered population of patients registered to me is 1,500 patients. So I'm managing 1,500 patients on 5 or 6 sessions a week, which is a lot more than you see coming out of the college surveys and the Medical Assurance Society benchmarks. And we do that across the practice. I'm probably a little bit more than my colleagues, but we're seeing a lot of patients. And we're servicing a lot of patients. And we couldn't do that if it was all just 15 minutes face-to-face appointments. Well, we could, but I'd have to be in seeing patients for 8 sessions a week or 7 sessions a week. I don't want to do that. I want to go mountain biking or go for a walk or do some building. I've got to erect a glass house at the moment. It's still waiting to be done,
Well, the quality of care you're able to extend to your patients depends on keeping yourself healthy as well.
That is very true.
What would you say to patients and general practitioners who are worried about losing that face-to-face, human-to-human relationship contact?
I would say this is an augmenter, not a replacer. Patients really like it. You can have a consult and then a query about it might come up and you just send a quick note and they say, oh, thank you. Patients really like it. And I think continuity of care is absolutely the secret sauce of general practice. Knowing your patients and them knowing you, them knowing their doctor. I know it's all very possessive, but I think it's quite useful in this context. We know that leads to better outcomes, lower costs, and generally more satisfaction for the provider and the patient. So you're getting your quadruple aim kind of stuff out of that. So I don't think it takes over. It augments it.
Richard, just to finish, what would you say are the 2 biggest benefits that the Manage My Health portal has brought to your practice?
I think it would be that efficiency. So efficiency around booking, efficiency around repeat prescriptions, and then and notification of patients' results. So that's one side of it. And then the other one, and we just touched on it, I think it enhances the relationship. I think patients like to feel that they can be in touch. They're respectful of our time, largely. So, yeah, efficiency and relationships.
That's brilliant, Richard. Thank you for your time this morning and your wisdom.
Thank you very much, Colin. It's been fun.